Okay, good morning. We are at the Town Council Health and Human Services Committee meeting at February 9th at 8:30 in Town Hall. And we're here to discuss the Health and Human Services budget. We're gonna start with not a presentation. Last night, the Board of Finance had a presentation by Health and Human Services. And anyone from the public is welcome to watch those presentations, which are on Zoom. So we're gonna start with Jen Allison, who's just gonna recap a few things about how things are going with her budget process, and then we're gonna move on to human services.
Thank you, Kim. So I'm Jen Allison, Director of Health. So our budget basically hasn't changed from when it was presented to Deanna in December, Board of Selectmen, Board of Finance. The part that I can control on the lower part of our actual accounts, I stayed at the Board of Finance recommendation of a 0% increase, which we were told in October. The top part, the full-time budget went up because my 3 full-time staff are town hall union. By union contract, they get a 2.75% raise July 1 of this year. They also get one next year. And also the 401A, town hall union got an additional 1% matching, so that's why that went up. So again, those are all fixed costs that there is no changing that. And on the bottom, we offset the increase with using Bluebeam. What Bluebeam is, we did launched online permitting, OpenGov, which I'll talk briefly about in a second. And in order to scale plans online, Bluebeam scales the plans, and that's $300 per user per year. So there's 3 of us, $900. We put 1,000 in the budget. But to offset that, I took out 1,000 out of office supplies, because by using online permitting, now we're not using all the supplies and the mailings and all that jazz that we would do for restaurants, salons, pools, trucks, and all that stuff. So the bottom, there's actually a net decrease of $180, and the top again, fixed costs. Revenue, I kept the same, even though what we've already seen with OpenGov and the online permitting, the plan review is the building permit review for health. And in those 3 months, which this is our dead time of year for building permits, November to February, I've already seen a 30% increase. But as I explained to Board of Finance last night, a little gun shy to just jump and change it midstream. So we're gonna wait till November 1 when we have a full year of data, and then that's when we submit to the finance department next year's budget. So I'll have a real number of what to put for next year's revenue. And then touching on OpenGov, that was an initiative that we launched. I was the project manager of that. It encompasses the health department, planning and zoning, the building department, inland wetlands, and DPW engineering. Now contractors can submit permits 24/7 through the online system. Before, the only way that we can do payment was old-fashioned paper checks, which nobody really likes to do anymore with all the issues. So now they can pay by credit card or electronic check. Electronic check, there's no additional fee. And as I presented in the slides and the data last night on OpenGov, the majority of the payments have been credit card, which we kind of knew would happen. You know, everybody wants their points and their miles and all that stuff. And OpenGov's been very, widely received. The contractors are happy. The permits are also now flying through the process. It used to take anywhere from 6 to 8 weeks to get a building permit through all the departments, especially if the department that started out was on vacation. That permit sat there and waited till they came back, no one else reviewed it. Now there's simultaneous review happening. The permits are going, within a week or 2, which has never been that fast in the 10 years I've been here. So everybody's happy. The homeowners even get to see where things are. And it's fully transparent. Before there was, zero transparency. You couldn't look anything up from the outside. Internally, you had to know an address to look up. Here, I see them all come in every day, so I can click on them all and make sure that the health department's getting their review that they're supposed to be getting, so. It's been, very great in the way that everything's done, so. Again, with the revenue, we'll, touch back to that next November, so.
Okay,
Just super
great.
quick question, is it transparent to everyone or just the, like, do you have
It
to-
can be, if you create an account, which is free,
Mhm.
you can look up anything, so if you see your neighbor doing work or whatever. You can look it up and see that they have a permit, and a homeowner, cause we had a pool contractor. That, within a matter of 2 years installed, 10 to 12 in-ground pools with no permits. So that meant no revenue being collected, besides the bigger issue, the code violation. So, and these homeowners, a couple of them really, had issues because the pool contractor didn't bother to check where the existing septic was, where the setbacks were. There was just a variance application Monday night about this exact thing. So the homeowner not only didn't know that there was no permit on that pool, now we have to install brand new septic because there is no variance to the public health code. The code is black and white, either you meet the code or you don't. So there he is now having to install a new septic because the pool was too close. Get a variance, for the pool, install drainage, and then still have to submit the building permit and pay that fee that hasn't been done. So now this is, what we did in the press release, months ago, is say that to homeowners, be your own advocate, because by law, you're the one legally responsible for what happens on your property. And before you go sell your property, if you've done any work, look up and make sure, because it has all the historical data too, that all transferred from Municity. So everything's there, the title searchers know, the realtors know, so it's just overall been very good to have a much more transparent system, and I'm all about
It's
transparency.
Blue Apron, it's a it's
Blue
per
Beam.
a Blue Beam, sorry, it's Blue Apron. Blue Beam is a per user cost.
It's a per user
Okay,
fee
so-
every year, it's not a software, you're just paying for a license fee like we pay for email license fees
Right.
with Microsoft.
Okay, so if you had more employees,
It'd be more money.
but
Right.
it sounds like the cost is being completely
Right.
offset.
Correct, by
Okay.
saving the money on not mailing everything out,
Right.
so.
I have a question for the public. Jim, someone wants to go on OpenGov and see these things and set up an account like Jennifer asked about, how do they do that?
So if you go on actually the health department webpage on the town website,
Mm-hmm.
at the top, there's an icon for OpenGov, but right below that, I actually put a link
Mhm.
for OpenGov instructions.
Oh.
So all the instructions are there, it explains everything, because when we launched, we also started restaurant relicensing then, we were communicating to the restaurants, almost 2 months in advance of giving them all the instructions, telling them everything.
Mhm.
And then if they still have any questions, they're more than, willing, able to contact us. We will walk anybody through anything. They can even come in our office and conference room.
Okay.
Because, we like to teach people to fish and it's a great program.
Yeah.
And, we're gonna have it long term and most of Fairfield County has it. So once you have an account,
Mhm.
like a contractor, he has that for every area. So when you submit something in Darien
Mhm.
or Ridgefield, it's the same account, you just go to that town.
But individual residents can open up their own
Yep,
accounts too.
for free.
Yeah, okay, great. Well, we want to thank you so much for presenting today. We want to thank you for initiating OpenGov and for all the work that you do. I mean, we heard what you do last night and I've heard it by coming to the commission and you're just so busy. I want to thank you for all your work that you've been doing for the town. Is there anything else you want to add? Because we're going to move on to human services.
No, just thank you guys for always supporting us, it's very important, like I said, the Board of Finance last night. It's important that we expedited that process with OpenGov and we didn't wait, so whenever we needed anything, we really appreciate the support from all of you.
Yeah, okay, great. Well, thank you so much.
Thanks.
Okay, we're gonna move on to human services. I just want to give a little bit of a background for anyone that's listening for the first time and just to clarify that human services has 2 parts of their budget. Feel free to add, Bethany, because you're the expert in this. And one is the salary line and other things that go along with office expenses and other, line items. And the other one is something called human service agencies. And if anyone's following along the Board of Selectmen budget, I'm on page 17. I don't know if anyone else has a booklet or is looking along online, but It says human services is one category and that's at a certain dollar amount, and then we have human service agencies. And one of the things we wanted to go over, especially this morning, is the human service agencies. And I'm gonna turn things over to Councilwoman Penny Young, who unfortunately has to leave in a few minutes to discuss what's been going on with that budget, and we'll have an open discussion about that. Penny?
Great, thank you very much. Last night was a great opportunity in the presentation of Health and Human Services budget to, as you said, be presenting the outside agencies' budgets as well. And in the discussion of that aspect of the budget, it became clear that some more discussion needs to take place about that budget and what our government's philosophy is for delivery of human services. As I said last night, with every new administration, there are different ways of doing things, and we welcome those changes. As we are all working together for the delivery of human services, it's important for all of us to be at the table, having input and questioning about what our philosophy is for public policy on delivery of services. There were some questions about how the budget was presented through the commission. There were some questions about some of the changes from the original budget to what then was presented, having come out of the Board of Selectmen. And there are some additional questions that would, be developed as everybody gets more and more into that budget. So the bottom line of the exchange last night with the Board of Finance was it would probably be a healthy exercise for the commission to step back and look at how their budget was presented with some support rationalizations, data as to number of people served, timeframes and all those other good things, which when you just look at the numbers, you don't really know, right? So if the commission could come join again around the table and look at their budget and rationalize it, as I said, the Board of Finance would welcome the commission or the department coming back on the 27th of February with the budget they would like considered. It may or may not be what was in our packet right now, because that will take place after the commission has revisited what their original budget was and the rationale for any changes or reinstatement of, back to the original budget. So basically, the commission is charged then with meeting and being prepared to come back on the 27th with the budget they would like considered by the Board of Finance.
That makes sense. So I'm looking at 3 budget proposals that Bethany shared with me. The first budget proposal was $299.5. The second proposal was $249.5, and we're down now to $176.5. So that includes cuts to Get About, the Kids in Crisis Teen Talk Counselor, I believe, New Canaan Cares had a cut, Child Guidance, Domestic Violence, Meals on Wheels, and a couple of other programs. So Bethany, can you talk a little bit about, those 3 budget proposals and what your thoughts are on going forward? And I know Dr. Pierce is here. Hi, Dr. Pierce. And I know you've been involved in all of this. Feel free to unmute when you want to speak, and we'd love to hear your input as well.
Great, so I'm Bethany Zarro, Director of Human Services in New Canaan. And I represent the Health and Human Service Commission, the Human Services aspect. So I have passed out, there have been a lot of proposals going through, and I'm giving you the 3 proposals. One was the original proposal, as Kim said, for $299,500. And to go back a little bit historically, the commission asks each year for me to look at the agencies to see how we utilize them and the wellness aspect of the community based on the individual wellness, where these agencies did help our residents. So I recommended to the commission, and they agreed, voted on the proposal for the 299,500. So that's where it started. We went in front of the Board of Selectmen, and before that, we went in front of a smaller budget committee, and we were told that it did need to be cut back. Based on just the environment and the strategic goals for the year, we totally understood that this was something that, we had to look at more seriously. So we went back and we went down to the, what was it, a 249,000, Kim?
242.
242,
I have 249.5.
okay, 249,500.
That's the original proposal, it's $299.
Right, so we went down, and then, the Board of Selectmen met. I met in front of the Board of Selectmen, and there was information that had transpired during the time to where the kids in crisis issue, that the high school Teen Talk counselor would be maintained, but the middle school Teen Talk counselor, that was not going to be an item that the town would.
And that was funded by a grant previously.
So, right, and to go back on that, we have not been paying for it. This was a grant that the Board of Ed graciously gave us to try out the Teen Talk middle school counselor. The area of schools are all, inputting this type of counselor in based on the atmosphere, especially Darien, unfortunately having 4 completed suicides the year before. We wanted to do some prevention. Their demographics easily mirror our demographics, and so we became, as a commission, that became definitely an issue that we wanted to address. So instituting another Teen Talk counselor at the middle school level, which many of the towns in the area are doing, we were granted the money. That money is no longer available.
Can I ask one thing briefly, but can you explain like the subtle difference, or if it's not so subtle, between what is just a garden variety counselor in the school and like just briefly, like
Okay.
kids in crisis, something that how they.
Right, so the Kids in Crisis runs separately from the Board of Ed. It's run under, the Teen Talk counselor runs under the Kids in Crisis nonprofit agency. Therefore, it separates them in terms of confidentiality. Now, that doesn't mean if a child presents himself or herself unsafe to others or himself, they will intervene and help needs to be implemented. But other than that, a child can come, and there's also, I'm gonna pass out these in terms of the yearly report for the high school Teen Talk counselor and the middle school Teen Talk counselor. So their kids can come in there for anything, and also the Kids in Crisis counselors, they educate kids. They're there at lunchtime. One is the high school and one is the middle school, so they're separate. So this is the yearly report that they've done. Also under the opioid settlement, which we are getting paid out, the town is, the type of educating they're doing on addiction and prevention education, this is all in line. This is all.
They're doing, just a clarification, they're doing stuff that's not covered by the counselors or the social workers or the psychologists in the school.
So they are,
Or is there an overlap, or?
there might be an overlap. The bottom line is it does not go on the child's.
Right,
Okay, so that.
Yeah. Yeah,
It does not go on the child's record, and the topics are a little more open. That a child can go in there, and it's a very non-judgment atmosphere.
Right.
Yeah,
So
as a parent, I'm sorry, I just want to say something, as a
Yeah.
parent of a child that's, a couple kids that have gone through SACS
Yeah.
and in high school. It provides, the Kids in Crisis provides another avenue for a child to go talk to a counselor that is just another choice besides the guidance counselor. And then they do have the safe haven option, which is for housing children that can't live at home because of family issues. In addition, they have the crisis hotline, the 24-hour hotline, right? So when I looked at our DERG, which is the other, schools in our district that we compare ourselves to, I believe Wilton is implementing teen top counselors in the middle school. Ridgefield is, and I believe Westport is. So the standard in the current atmosphere that we're in is that schools are asking for teen top counselors to be in the middle school. So I think one of the points that we can look at is Bethany and the commission has recommended a teen top counselor. Whether it comes out of your budget, Bethany, or it could come out of other grant money, and or it could come out of opioid settlement money, which is a very broad brush, qualifications to pay for different kinds of programs. But I think it's clear from, the feedback that I've heard from guidance counselors and other people and parents at SACS that they really welcome having another avenue for their children to speak to someone who's a professional.
Exactly, and I just wanted, this is in terms of I'm passing out the surrounding towns and how they're funding
Oh.
their kids in crisis counselors, how many they have. And then this is from Tony Boucher, in regards to support, it was a Wilton, Connecticut meeting that she had in terms of explaining kids in crisis and the value that it offers to a community and supporting the fact that it should be in all our communities.
Right, so since this is a public meeting, what I'd like to do is attach these documents to the minutes for this
Yes.
meeting, so if anyone from the public wants to look at all of the wonderful descriptors that Bethany has provided to us, then it will be out there for everyone to be able to look at.
Yeah, it's a lot of information,
Yeah.
but I'm grateful to be here today to provide this.
Yeah.
Once again, Human Services, we're here to educate.
Right.
And right now, ironically, we're educating on our department. It's a very quiet department. It's very underneath the radar, and there's a reason for that. But right now, when it comes to the community itself, I'm grateful to have this outreach to explain a little more of what's going on and how it creates a well community. Individual wellness creates community well-being. And so this is where we're at, and this is the goal and the mission statement of Human Services.
Right, and could we also go into, so we talked about the teen top counselor, could you talk a little bit about the outside agencies and how Human Services addresses the needs of the most vulnerable in our town, who need services, like for instance, the Domestic Violence Crisis Center. I think last night we talked about how many calls or how many inquiries from New Canaan residents were made, that people who needed help, and why this is so vital to keeping people healthy and safe.
So here are the numbers. I will verbally say them, and once again, it's another example. So for 2023 fiscal year, this came yesterday from Domestic Violence Crisis Center, which I'll refer to as DVCC. This is all from New Canaan. This is not county-wide. This is New Canaan. 66 victims of domestic violence came through. And they helped them finding out what their needs were, whether it was safety, housing, things like that. They had 560 referrals and information phone calls. Where to go, what to do. Is this considered domestic violence? What is, is domestic violence verbal abuse? Learning, educating, they went to DVCC. They did 47 interventions with the victim and an employer, a creditor, a landlord, or an academic institution. They did 257 crisis interventions. This is New Canaan only. And they did 122 counseling sessions. So this is just an idea to give you why I proposed and the commission proposed $10,000, which they requested on their grant proposal. We felt the community was in need of this type of agency that we cannot provide at Human Services itself.
And there's actually a benefit that is confidential to residents, right? Because you said that domestic violence victims don't necessarily want to come to Human Services. So this is an avenue, kind of like the Teen Top Counselor, where they have their confidentiality protected and they can get services without.
Correct.
Yeah.
Correct. Last year, when there is a domestic violence dispute and it's a police record, Human Services does receive a report to follow up in terms of safety issues. So to give you an idea, those numbers I just gave you, we have on average a year of 35 reports.
Right.
So these are people that are afraid enough to call 911,
Yes.
but look at all the others that just, that for whatever reason, they're going outside the town
Right.
for help.
So this fills a huge need. And if I'm not, I remember going to the Health and Human Services Commission meets once a month. And I remember you had the DVCC, I don't know if it was the executive director or a representative
Yes.
come and speak to the commission. So can you talk a little bit about how the commission is made aware of what these agencies do? And then they make recommendations in concert with you and Dr. Pierce about what the community needs.
So just for the commission, it's a very altruistic commission. They want to know and they want to make a decision based on as much knowledge as possible. So each month I have the director, somewhat representative from these agencies that we provide general operating purpose funds to come in and they explain and they ask questions and answer the questions. So they do reach out and give, without names and everything, situations and who's coming to them from our town. And as they say, the question always comes up, don't you get funding from the state and federal funding? And they said, absolutely, but that is funding for the people that come in and that we help. It does not cover operating costs. So we have to find ways to operate. So the general operating purposes, the grants that we give them, they can utilize. It's not for the person that's being helped, as in the state and federal payment system is doing. This is for their general operating purposes. And so we can help out that way.
So can you make the connection for anyone watching is what the connection is between making those grants and how that serves the resident? Because I think that was some of the, some of the thoughts about why these grants should be cut is because the state provided money for services, but Human Services has a different point of view or has operated a different way. I believe since 2010, these grants have been given in different amounts. And how does that benefit the New Canaan resident, would you say, if we're being generous to these organizations?
So a couple of things. Number one, financial assistance, the town, we are not allowed to provide money up front. Let's say a divorced mother needs to move out of the house. And so they're gonna go into renting. She needs first month, last month, and security deposit. The town cannot provide that. It's very expensive. What we can provide is maybe help with the first month. Because it is real time money being spent. We can't help with the security deposit for last month's rent. These agencies can. They can help out and make the big investment so these children can stay in school. So the mom can continue her job, the routine, trying to keep normalcy in an upheaval point of time, crisis. Once again, we're here for crisis.
So Jen, so can I ask a question? And I think so this pulls in Dr. Pierce and us. This is how I interpreted a little bit
Okay.
what was going on and maybe also what Todd might be asking for the Board of Financing, Board of Finance from us. Is I think he used the word, like, the amounts compared to the overall budget, he used the word de minimis. So what I think also is going on, as apart from like the grants from the states, you know, and the discrepancy between, you know, operation and individuals, was that the philosophic difference of should the town be, even if it's de minimis amounts, giving grants to organizations, not-for-profits, to have the ability to do outside fundraising. And so I think that's like the conversation, how do we make the argument? Yes, like we do need to help support that. Is that?
Yeah, I mean, I think that makes a lot of sense, and I think you've hit on like a point of maybe what we're trying to work through, right? But I think Penny had brought up that this is a conversation for the commission, and it might be a policy change if there's any major cuts, because now we're getting into the point where, you know, making a change like this without mindfully looking at, is this a policy change?
Right.
This has been going on since 2010, so this is something that the commission could discuss in more full with Dr. Pierce's direction and with Bethany's input, and come up with changes that maybe they wanna study over time and come up with those solutions, rather than saying, okay, because we're in a certain budget year, pressure to cut.
Right.
Yeah, let's, why don't we just take a step back and, as Bethany said, so the different agencies, and over the last year, we did have a speaker from all these agencies whom we have granted in the past, come and just inform the commission, and it was very good, informative. And after the last few, I said, couple anyway, I said to Bethany, just to let you know where I'm coming from, I wish we had more money to give them. And a couple of them, like Catholic Charities, whom we haven't contributed to so far, family centers, which was Centers for Hope, which hooked into family centers a number of years ago. We have, and they said that really the money that we give them is for administration. Although I think the state, you know, who knows what the compensation is or what they're paid, you know, there's got to be a little portion of that where they consider administrative costs because they're part of doing business per se. Anyway, so I mean, that's where my sentiment was, if we could only give them more money. However, Bethany and I met or spoke at different times with Deanna Carlson, and she, representing the Board of Selectmen, had said they were having budget crunches, and they looked at our numbers, and our numbers had gone up about 20% a year. And she had petitioned for us to cut our budget by $50,000. So if you look at it, it was 299, 500 initially. We did pare it back 50,000. So we got to those numbers, and then which was fine, and I understood where they're coming from, and they were in unison. And yeah, we had been going up quite a bit, I guess, you know, looking at the numbers, and I guess it was time to cut back or level off. So we did that, and as you peel down the expenditure columns and you bring it up to the year 25, you can see what we've done. We have pared it back. Now, we were informed prior to our last Health and Human Services Commission meeting that, or informed at the meeting, that the Board of Finance had discontinued the salary for the Sachs Middle School Teen Talk Counselor. So that 96,000 there, or the 144 disappeared, and then became 96. And so that's, right now, we were not going to finance or be involved in paying for the Kids in Crisis Teen Talk Counselor at Sachs. Now, information has come which kind of backed that up somewhat, that you know, they felt it really wasn't needed. I think they overall, and this is from the inside, people with experience, and I've spoken to people and what have you, but I'm not there on a daily basis to see actually what's going on, and none of us are. So you just have to go with it. So we did go with that, but then we got some other conflicting information that maybe this was a good thing, and we to have this Teen Talk Counselor at Sachs, and the kids were going to be missing something. So you know, we've been toying around with how to do that and what have you. I did emailed and then spoke to Deanna Carlson yesterday, and she reiterated the information which we had when we were okay with cutting the funding for the Sachs Teen Talk Counselor. And so as much as I wanted it, I backtracked. I said, you know what? I think that's where they're coming from. They do have information to back the decision up. They're administrators, both for the town and the Board of Ed, the school system. So I think right now, that's where I am and that's where we are. With some of these other things, when you look up and down the budget there so New Canaan Cares went from 18 to 8, but we're giving 10,000 of opioid money, so that's going to pump it back up to the 18. We actually cut that from the 249 to the 176. We're looking at, the town is committed to give $50,000 this year to the New Canaan Urgent Assessment. So that was the 50, and then we paired it to 25, thinking we could actually kick in 25 from the opioid settlement, and that would save a little bit of money for the town, which was a good thing. It would being covered, and then we were toying with opioid money too for the SACS Teen Talk Counselor. So I think bottom line here is, yes, we've cut back on the budget. I think the 249.5 works for the town, the administration. Bethany and I did meet with these Tucker Murphy, Cheryl Jones, Deanna Carlson, went over these numbers, and what we worked out when you have the proposal number 2, that was where we were, and then we cut it back a little more to proposal number 3, but just shifting it back to 249.5, I think would be what the town is asking us to do. So that's where we are. I'm not sure. I mean, I guess we're charged now to meet and go over these budget numbers, but I felt when we walked away from meeting with the people that I just mentioned, that I think Bethany and I felt that this was good. It was a good meeting. We did have town input as to what their perspective was. And, I think there's also a perspective on some people's part that, a lot of these organizations their service is directed towards all the towns in this area. And I know Deanna Carlson has spoken to at least one selectman from another town, and they contribute nothing to these agencies. Now, Bethany did a little research, and yes, there are other towns that do, like Westport, Greenwich, et cetera. So we're kind of in between things in terms of where we are, but I think looking at the budget, I think the final one that was worked out with the town people works.
Yeah, next question. What do the administrators, the school administrators at SACS feel about Teen Talk not being there? Do we know how they feel?
So from,
Well, I'll answer that. I mean, you can too, Bethany, but yes, the initial information was that they were okay with not having a Teen Talk counselor there, which was a little surprising, but that's what it was. When I say surprising, because given the number of kids and all the issues these days, but there are other avenues to approach that. And then we got other information that no, this was a needed entity at SACS, but this was really came from a person that works at Kid in Crisis, so there may have been a little overinterpretation of the need. Slight conflict of interest, maybe that's carrying it too far, but and then went back and get the story from the administrators at SACS and the public school system that they are okay without a Teen Talk counselor at SACS. I mean, a year without one may tell a different story. The good thing, the advantage to Teen Talk counselor is having someone there, and the confidentiality is big. But there is overlap. They do have their counselors, and the New Canaan did not have this forever. The Teen Talk counselor at SACS, this was just generated over the last couple of years. And unfortunately, with Teen Talk counselors, we haven't had great experience in terms of permanency. There's a shift. They last for a year, maybe 2. It takes a while to build up clientele, so to speak. The person who was at the high school last year left. They do have a new person, Martha, who's only been there for a month max, and very positive comments. But, these things all start to weigh negatively too. Had issues with people at SACS leaving.
Yeah, I'm just gonna interrupt. I think there's a huge, dearth in mental health providers, so that is an unfortunate part of it, but I did look at the utilization numbers that Bethany provided, and they were almost, the utilization numbers at Saks were almost as high as the ones at the high school in terms of the amount of students that did utilize the teen talk counselor. And I think, our job here as town council, as elected officials, is to advocate for the residents. And so I've heard a lot of very positive comments about the teen talk counselors, and I don't think the commission has had an opportunity to discuss this, right? This was kind of, you were told that the Board of Finance cut it, but it wasn't in a public meeting where the people could hear the rationale and look at the numbers. Now, Janet had asked a question. Janet, did you ask
Yeah,
that?
that's true.
Janet,
Yeah,
can
we
you
really didn't.
again about the feedback from the staff at Saks? I think you would ask.
Right, the administrators, what are the does Dave Gussich think that it's important?
So,
Like,
and this is, I'm talking from hearing this.
Yes.
Harrison, another side, there are two sides to the side. I heard from the staff administration, I just wanna be careful, I wanna give the facts.
Yeah.
That the teen talk counselor is very busy. Whenever someone's gone past the door, this particular person, there's always somebody in there. A child needed to make an appointment, wanted to see her, and was not able to get an appointment for a couple of days. The teen talk counselor, she's there at lunchtime, in the cafeteria, she's educating, some of the classes that she's teaching. And this is also 24/7 access to a crisis center, which the teen talk counselors have to, if I'm still correct, every weekend, the teen talk counselors, they circulate in terms of who's gonna be at the crisis center. So they're learning more, about not just our area of kids, but who's coming in from other areas, towns. There was nothing but positive. Somebody from the Board of Ed higher up said it was quoted to me, it would be a loss to the middle school. And I don't think the parents would be very happy to hear this.
Yeah, I think the 24-hour coverage is key because the school does not have the ability to respond on Saturday afternoon, Saturday night, and I know the clergy all over New Canaan can use the teen talk crisis hotline to refer parents to that are having crises on the weekend. So I think that 24-hour piece is huge, as is the safe haven piece. Right, can you talk a little bit about that, children that cannot stay at their homes?
Right, so if there's an issue 24/7 where a child feels unsafe at home, or the instability is just creating anxiety and they can go, Kids in Crisis will come and get them, they take them to the safe haven house. They try to maintain a sense of stability, and whatever is needed, the counseling, it's a crisis intervention.
And can I ask, how are the parents involved? And is that one of the differences? Like, let's say a student is not comfortable talking to a parent about what is happening. Is the difference that a teen talk counselor is separate from the school? And is it reported back to the parent what is happening? Like, I'm just,
Yeah,
how does
only
that
in the event that the child appears to be, after an assessment, unsafe to himself or others.
Mhm.
That is the reason. Other than that, it's a confidentiality.
Okay, wow.
Yeah, it's a confidentiality issue, and they will maintain that with the child. So that sense, that trusting, non-judgmental environment, people, parents, faculty and staff, it is definitely, what I've heard, a very welcomed piece at the middle school.
Okay, that's important to know. So I think last night at the Board of Finance meeting, you were invited to come back with adding into the numbers that you had presented last. Right, you were invited by Todd to come back with another, or different budget numbers. So what Penny and I were wondering, and I don't know if the rest of you agree, is that the town council, the Health and Human Services Committee would meet again to go over what should be added back into the budget and what your expertise comes up with, as a group collaborating together to come up with those numbers.
And can I piggyback
Yes.
to that, just because you know, maybe in Penny's absence now, I was just thinking back to last night, because we've talked a great deal about at the kid level, but on the senior level, she referenced transportations in other towns, so I assume that that was reference to the Get About, and then that's affect that, so. That I think we should think about.
Yeah.
Yeah, we'll talk about the seniors too, definitely.
Do you want to do that now?
Sure.
Okay,
Yeah.
so the Get About, which is our senior and disabled transportation, which is an unbelievable, just in the town of New Canaan, it only operates for New Canaan residents, but they can go to medical appointments, Stamford, Norwalk, I believe Darien, possibly Wilton, I could be wrong. Anyway, I'm gonna pass this around. So far in 2023, they surpassed the COVID because they were not working for a year or two.
Right.
But in 2022, they provided 8,000 rides. 2023, 9,700.
Wow.
And then it breaks down in terms of where they went. General rides, medical rides, to which hospital or which town. Yeah, it's Stamford, Norwalk, New Canaan, Darien, Wilton. They also take adults with special needs to jobs. 1 to 5 days a week. It's unbelievable. So this is run for the town. And I just wanted to hear some up-to-date numbers.
Right.
That is another, and I think it's important that Human Services covers the age spectrum.
Yes.
So this is an ideal agency, nonprofit that we can help with. And it provides transportation to the food pantry, which is double. For those that sometimes you do not have to be 60 and disabled. They will pick up a one shopper that doesn't have a car
Mhm.
and needs to get food.
Yeah, so it looks like they're providing almost over 100 rides a day. I mean, I don't know how difficult things are, but they're a highly utilized service.
Right now there are 4 to 6 vans that they are able to use.
Mhm.
I mean, to buy a van and to equip it, to outfit it so that it is ADA compliant. It can be wheelchair, it's over $60,000, and these vans, they go through them every 2 to 3 years. I mean, it's not highway driving smooth, it
Right.
is around town,
Stopping.
stopping and starting.
And it's volunteers, Bethany, from the community that do the driving, is that correct?
No, so they are paid employees.
Oh, they're paid employees.
By
Okay.
the town, they
Okay.
do have to have, a type of driver's license, they have to be vetted.
Okay,
And,
so they have to pay for that, the gas, the outfitting of the vehicles and other overhead expenses.
everything, yeah.
Yeah. So in your.
Drivers, yes.
Right, okay, any other questions about
Wait,
getting
is it true that we're the only town that does this kind of, I mean, other towns obviously do it, but
Well, that's what I was like clear about, like from her comments last night, how, like.
So
what
Wilton,
happened.
a lot of towns outsource, we
Yeah.
used to outsource Norwalk transportation. And it was costing thousands of dollars for Norwalk transportation. Get About, we don't need Norwalk transportation anymore, because of the value, and they suggest a $3 donation, you don't have to do that. You don't, and so they do run through donations and the community spirit.
So it sounds like other towns in Fairfield County have it, they just have different models of delivery.
Exactly.
And I think in Wilton, it was 170,000 that was spent for
Yeah.
their service, so we're spending significantly less than that by this contribution.
Right, and they do get grants, there's a grant that I put in every year, and it's the municipal grant program for senior transportation. And we usually get between 26 and 28,000, that
Mhm.
helps.
Mhm.
Norwalk Hospital, Stamford Hospital, they put in money, that helps.
Mhm.
New Canaan Community Foundation, it all helps. But the town, it's very valuable it's a very valuable service.
Right. Now, can you also talk a little bit about Meals on Wheels? Because I know that cut was a 75% cut, and I know that's a widely used service in the town as well.
So that's a widely used service, Meals on Wheels services 45 to 55 individuals at a time. Some is short-term, just post-surgical rehab, others long-term, housebound and unable to cook. So it averages between 45 and 55 clients, anywhere from delivering one delivery a week, which consists of 2 meals and a snack, or 5 deliveries, Monday through Friday. So they, once again, they do get assistance from state, federal, they work with Catholic Charities. We are looking at the general operating costs, and we also have clients that age into not being able to go to the food pantry anymore, things like that, or that. So we call Meals on Wheels, and since they qualify for human services, they automatically qualify for Meals on Wheels. So they're providing free meals
Right.
for the clients, as well as people in the area, you know, that are on short term or long term. The volunteer basis, I'll tell you what that also does, to have someone come to your house every day and deliver a meal or once or twice a week. Some of the residents and the clients, that's their moment of contact with the outside world. In a quick conversation, and these are volunteers in the community.
Yeah.
Also, Get About does deliver, if there aren't enough volunteers, Get About delivers the meals. So once again, we're utilizing Get About in a number of ways, not just for the senior transportation,
Right.
which is huge.
Right. It sounds like it's an invaluable service.
It's
for
about the
senior
community,
to-
yeah.
And it gets everyone in.
And the board is unbelievable, the employees are unbelievable, and they all wanna help make it work.
Right.
So it's a message, it's as I said, the original proposal, Health and Human Service Commission. I wanna, reiterate, yes, I recommended, that the commission recommended, that would recommend this. At the same time, I understand there's a strategic move going, to help with the budget. Where we're at right now, I'm just hoping somehow there can be a balance where we can still maintain that community level and that interest and that message.
Right,
to the
like
community.
philosophically to show that we're behind this,
We're behind.
but while being cognizant of a difficult budget year, I think. that's
Difficult,
about-
yes,
Yeah.
I mean, I understand the fiscal responsibility.
Mhm.
And will this deter from helping our community by going down on these grants? I don't think it will, because I think other sources will come in, but in terms of the sustainability, I think it's important that the town sets a precedence. But then again, like Penny said, maybe we're talking policy changes too.
Right.
Yes.
So a little bit of an influx time,
Right.
yeah.
So what I'm wondering is if we as a group meeting here today want to make a recommendation to the Health and Human Services Commission to take this up at, call a meeting before you go back to the Board of Finance, which is on February 27th, to discuss how you want to reallocate some of the funds. And also, I think Todd said to add, you could add more money into the budget. So I don't know if you as a Board of Finance member want to speak to that at all, or if anyone else wants to.
Yeah.
Because we have to increase him.
So Bethany, thank you so much
Yeah.
for everything you do. Every time I hear you, I'm so impressed with what
Oh,
you're
thank
doing, with the town does. And,
Heroic.
and I really think that these numbers are so insignificant, as I said in the meeting last night, in the overall town budget. Some of those 2,500 it would send entirely the wrong message. And I do think Todd picked up on that, and he did invite you to come back and restore these relatively small amounts, whether it's 20,000 or 40,000 or whatever that number is. But I think I agree with Kim. I think you should go through the process,
Yeah.
come back with recommendations to the Board of Finance. I think you put together exactly the information I would have asked for, which is what are the other towns doing? They are supporting these organizations. And And I think you've done everything you need to in terms of the homework for this.
Yes.
So,
Okay, and it's the
but-
education. I do have a couple more. New Canaan Cares, their numbers.
Yes, okay, that's
Mr.
good.
Gaskino, I have not done a spreadsheet yet,
Right.
only because it's apples to oranges, but I know you wanted numbers.
Yeah.
And this helps, and here's child guidance. Every quarter they send us.
Okay, great. So what we'll do is we'll post these on the, with the meeting minutes so that anyone that wants to look over these numbers can see those numbers. Now, I know that the Health and Human Services Commission does not meet before February 27th. You won't meet until
Correct.
March, and you need to get, back to the Board of Finance by February 27th. So is it possible, Harrison, for the group to call a meeting and rediscuss, you know, where we're at now, because it has gone through, we have 3 iterations that, you know, proposal number 1, 2, and 3, and now we're kind of in proposal
Yeah.
number 4. We don't know what that is based on the expertise of the 9 members of the Health and Human Services Commission who are well, you know, versed in all of these issues. Well, we can't hear you, Harrison. Unmute.
We can call a special meeting, yes. I think we can also check and see with the Board of Finance if that date is movable. But we'll deal with that.
I don't think
Yeah,
it
I don't
is.
think it is,
That's
it's a very set.
Yeah.
Number of meetings.
It's not council.
It's very sad, Harrison.
Yeah, not that their meeting would change, but when they want to hear from us. I'll check.
It has to be moved on to the town council, so I don't think there's much wiggle room in that February 27th deadline, because then they have to discuss and vote on the whole budget and then move it on to the
Oh,
town.
okay, all right, that's fine. Yeah, we'll call a special meeting or do something before then.
Okay, that would be terrific. Okay, I think we're, anyone wants to add anything?
Any
I think we're ready to
questions?
adjourn.
Yeah, any questions on the agencies? You know, there are a lot of numbers we can give, a lot of qualitative, more than quantitative, but I hope this gives a baseline.
These are really helpful.
Yes, they're very, very helpful. Thank you so much.
Absolutely. I know some of our email based, but I just didn't have.
This will be great.
This is
Yeah.
very, very persuasive.
Yeah, I mean-
Thank you.
It's basically data to support all the things that
Yes,
you do
yeah.
in getting into the granular data, which is incredibly important. And thank you so much for all the work you do for the town.
Thank
And
you
thank you for all the extra work that you've given us.
Oh, no.
You've done today.
Thank you for listening,
Yes.
because it's on the, it's the community that's
Mhm.
hearing
Yeah, definitely.
by these conversations, and I just, I remain neutral.
Yeah.
In terms of my job, but in my heart,
Yeah.
like Harrison said, I wish we could do more.
Yes,
So there,
yeah, terrific. Well, we're so lucky to have you.
thanks.
So we're gonna end the meeting now. Do I have a motion to adjourn?
So move.
Okay, we're gonna adjourn. Thank you so
Thank
much.
you.
Thank you.
So
Thank you.
before we do that, how do we turn this off?
Bethany, can you help me? According to the cloud, it's right there.
Oh, you got the mouse. Okay, so and maybe for all of the
Yeah.
cover, right? And right?
No,
Oh, yeah.
I think.
Oh, there we go.